They want you there.
Quit talking. Ready, Olivia? Okay. All right. I'd like to call the Human Services Committee for October to order. First thing we need is approval of the minutes for September 18th. Do I have a motion to approve?
So moved.
I'll
Second.
second.
Okay. All in favor?
Aye.
Do we have privilege of the floor next? Is there anyone here to address the privilege of the floor? Anyone for privilege of the floor? Seeing none, we will go to our first tabled resolution, which is to amend the Chautauqua County Department of Mental Hygiene and Social Services 2024 budget for increased services for recipients cost. I will need a motion to bring this off the table.
So moved.
Do I have a second?
Second.
All in favor?
Aye.
Aye. It's off the table. And you all should have an amended version of the resolution in front of you.
All
Take
right.
it away.
All right. Good evening. Sam Zaffuto, Deputy Director of Finance. This resolution is to amend the budget for the service for recipients for the Social Services Department. Traditionally, in the past, this department only would have really had non-TA residential domestic violence charges to it. We have had an increased cost in that, but there also is another agreement now. There's been some changes at the state level that kind of required us to get more of our contracts reviewed through OCFS. Some of that dictated payment lines now pushing certain agreements back into the BIC state system, also dictates where it's claimed. So there is now a second agreement with the GA Home, basically, that's also being through here for parents as teachers. So those are both coming through here now. That does require a budget amendment. We do have some extra money, it looks like, in the training school, which is the residential custody facilities at OCFS. Going into the 2024 budget, we were assuming a daily rate of $2,000 per day for the year of 2022. We got some very good news last February. The daily rate was only $1,400, but the budget was created with a much higher rate for 2024. I also did get in touch with OCFS. I have the number of days of youth in custody to date this year, who is in custody, who is out. So I'm fairly comfortable at this point with the information I have of moving that money based on it will not come back at the end of the year. The caveat being if 10 youths go into custody tomorrow where the daily rate is $10,000 a day, then that's kind of outside the control I have at this moment. But I'm comfortable moving ahead, at least in my opinion, with this amendment at this time.
Okay. Any questions? Concerns? All in favor?
Aye.
Aye. Thanks. Thanks, Sam. Next up is a proposed resolution, amend New York State Environmental Facilities Corporation agreement for septic system replacement program. Hello?
Good evening, folks. I'm Jessica Worsley, Director of Environmental Health for Chautauqua County. So this resolution is actually an amendment of an existing resolution that was originally passed in 2018. The Environmental Facilities Corporation has money available to assist folks who are in need of septic system replacements. And we were contacted in late 2023 that the breadth of this program had been expanded such that we could now include more water bodies, and the program will be extended through March 31st of 2027. So we're asking for a resolution to amend this resolution to put it back into play and let us use that money to assist with septic system replacements.
How do they go selecting who gets the money?
So
Like a first
this.
come, first served?
Well, so this funding in particular has a very strict set of criteria about locations, around water bodies. So the contract through Environmental Facilities Corporation has identified the water bodies in question, and we can assist properties within 250 feet of those water bodies. So then, yeah, at that point, if they have met that criteria and if their system is determined to be failing by our Chautauqua County Health Department staff, then they would be eligible for this assistance. It's not a full amount, so they won't get reimbursed the full amount, but it could be, the language in the Environmental Facilities Corporation contract is up to 50%, but not exceeding $10,000. And there aren't any sort of income qualifications or any of that. It's purely based on the physical proximity to those certain water bodies that have been identified.
Is there residential requirements?
The original back in 2018 had restrictions that we could not use it for seasonal, secondary, vacation type homes, but that guidance has since been revised so that at this point we are able to use it for residential and seasonal occupied homes.
Question. Waterways, could you be a little more specific in sense that, we have other lakes in our area, so I'm assuming maybe Bear Lake, Castaic Lake, some of our waterways are, the creeks and reservoirs?
So yeah, we have a very specific list that was actually provided to us. We didn't get to choose them, but they include Silver Creek upper and lower tributaries, Silver Creek Reservoir, Fredonia Reservoir, tributaries to Fredonia Reservoir, the Brockton Reservoir, the tributaries to the Brockton Reservoir, Chautauqua Creek, including tributaries, Minton Reservoir, which is your Westfield Reservoir, Upper Belson Creek and Gage Gulf and Tribs, Lake Erie shorelines, French Creek area, and Chautauqua Lake, but it specifically the areas around Chautauqua Lake that are not in the mix to be receiving municipal sewer in the near future. So yeah, they've got very specific water body ID numbers and everything. So we're working on creating a GIS map right now to actually create a layer within our daily GIS software that we use, so that when our staff is out in the field, we're able to just pull up that layer and say, yep, you qualify for this program. Let's talk to you about what that can look like.
Mm-hmm. Good, thank you.
Mm-hmm.
Any other questions? Okay, all in favor?
Aye.
Aye.
Thank you, folks.
Thank you.
Did you make an amendment on the last resolution, the first resolution?
Yeah, the first resolution needs to be amended.
Oh. I'm sorry?
I missed it.
Okay. So, back to the first resolution.
I'll make a motion to amend it as the corrections that are laid before us.
Okay, do we have a second?
Second.
Okay, all in favor of the amended resolution?
Aye.
Okay, proposed resolution number 3, amend the 2024 budget to transfer American Rescue Plan, ARPA, spending plan budget for the PPE replenishment project.
Yep, good evening again. Sam Zaffuto, Deputy Director of Finance. This is just a transfer of fund, as we just mentioned at the Public Safety Committee. This was a collaboration between the EMS department and the Public Health, which this was budgeted under Environmental Health. So EMS, they were working together to kind of move this ARPA project to a conclusion. We are not fully there yet. But this is just a budget amendment for the piece that EMS purchased with Dr. Falk as the Chief Medical Officer's approval, and he had kind of run it through the Director of Admin Services, who also was serving as our ARPA administrator. So this is just correcting the budgets for where we're at to date.
Okay. I heard it once, so,
Yeah.
any questions? All in favor?
Aye.
Okay. Number 5, the proposed resolution setting the salary for licensed behavioral health therapist.
Carmelo Hernandez, Commissioner of Mental Hygiene and Social Services.
And Jennifer Rissell from Department of Human Resources, appearing on behalf of Debbie Makowski.
This resolution here is already budgeted for 2024, and it's essentially a retitling of the positions. So you'll see it in number 4 and then number 5, where instead of having 8 different positions for behavioral health therapists, we'll have a licensed track and an unlicensed track. And what that allows us to do is, in the past, in order to get promoted, you had to be a licensed clinical social worker. This opens up the opportunity for our licensed mental health counselors to also be promoted to supervisors as well.
I just want to clarify, and those other two, because they are transfer over to a different title, and the existing titles are being eliminated, is that correct?
Yes, they will not be backfilled. Correct.
Thank you.
Okay. Any other questions?
Sure.
Okay.
It's, Carmelo, is this a wage fair, would you say that this is a wage that you see throughout this field and other areas as far as other counties, but also, I guess, stretched out into outside of government, in the private sector?
I would say for us, yes, especially when it comes to the loan forgiveness program that we have, the 35-hour work week, and also our continuing education units that we provide as well, and ongoing training, and all the holidays and the contract that was negotiated with the union. It is fairly competitive.
Okay, thank you.
Loan forgiveness, is that 10-year program plan? What's the loan forgiveness?
Yeah, loan forgiveness for individuals that go get their masters. They work for the county. We are one of the programs due to what we do and being a county entity that your loan will get forgiven after X amount of years, exactly what you're saying, 10 years.
Yeah. Thank you.
Anything else? Okay, all in favor?
Aye.
Okay, now number 5, proposed resolution setting the salary for licensed behavioral health therapist.
Once again, Carmelo Hernandez, Commissioner of Mental Hygiene and Social Services.
And Jennifer Rissell from Human Resources, appearing on behalf of Debbie Makowski.
And once again, this is similar to number 4. Instead of having 8 or 9 different titles, this is for our licensed professionals, LMHCs, LCSWs, LMSWs as well. And this just gives them, it was already budgeted for 2024, and this just also allows us to have 2 different tracks and also allows them to be promoted to supervisors as well.
Any questions? Okay, all in favor?
Aye.
Aye. Thank you very much.
Thank you.
Now we have our first discussion, which is the Division of Temporary Assistance Report presented by Diane Anderson, Director for Temporary Assistance. Sure.
Diane Anderson, Director of Temporary Assistance. And I'll be reporting out on the month of June. The New York State participation rate for June is 14.3, and the rest of state is 11.1. Chautauqua County is 8.6, and Chautauqua ranks out of 34 out of 57 counties, or 22nd in the state for the highest rate. In the month of June, there were 44 individuals who were participating and counting in the rate. In the all families rate, the participation rate, if we only looked at the non-exempt, would be 12%. And there were 53 conciliation notices sent to those who were not participating up to the maximum number of hours. And there were 28 sanctions processed for failure to comply with work activities. Of those 28 sanctions, 11 were in the all families category, 9 were in safety net, and additional 8 were sanctioned for noncompliance with substance abuse. And there were a total of 43 individuals in sanctioned status, and 34 of those individuals were beyond the duration, and 27 of those 34 who were sanctioned counted in the participation rate determination, even though we were not able to require them to do any work activities while they're sanctioned.
Can you just explain what being sanctioned means?
It means that they're losing a portion of their benefits. So if one person in a household of 5 is sanctioned, they prorate the benefit. So they'll see a decrease in their benefit.
If it's 1 in 5, then it decreases at 20%, or?
Geez, I'm not sure
It's-
exactly what the
okay.
amount is. I can look at it though and get back to you,
No,
but,
it's fine, I
Yeah,
just,
I would like to know that.
okay, sure.
I have a question on that particular section too, just, so, you know, in the notes it says sanctions for non-compliance with substance abuse requirements. What are those substance abuse requirements? Are they required to take, some sort of screening or testing? Could you elaborate a little on that?
Yeah, they are required to go through a screening, by my staff will do the screening, and then if there are indicators, they would refer them on for further assessment. So it could be for failure to, most people comply with the screening though, so it's more than likely that they don't show for the assessment or for the mandated treatment afterwards, if they're mandated to continue treatment.
Okay.
And I have some numbers when I get to the IMA report that will tell you a little bit about those.
And really, it's a program to help, I mean, it's in place to try to help those that are, have a substance abuse, to help them with the services that they need to, connect them with those services to help them, overcome those substance abuses.
Yeah.
I mean, it's a bad thing for them because they're getting hurt for it, but there's a corrective plan for them if they so choose, and they wouldn't get sanctioned, so, it can be a win.
Correct,
for
yeah.
them.
Yep.
Thank you.
Trying to get them back to being self-sufficient, so,
Yeah.
yeah.
I remember you saying that part of the issue is with the numbers, with the low numbers, is that what you have, at least, this is what I remember, and correct me please, is that some of the people, in fact, a goodly portion are complying with some parts of things, but they don't meet the full criteria, and if they don't meet the full criteria, then they don't get any credit.
That's right, for the participation rate, that is
Yeah.
correct. So we have right now 44 people that are participating and counting, but there are an additional, I think it was 148 that are participating, just not enough to count. So if somebody has an issue, especially towards the end of the month, say with childcare, and they aren't able to go to their work site or whatever the mandated activity is, then they have no time to make up those hours, and it counts against us in the rate.
So can you give us like an example of that? Cause it's like to a certain extent, are only certain people required to go to work? You said like with a work program.
Right, it could be a public work project, so they could have to go to a work site to put in hours at the work site, or it could be some other mandated activity, could be English as a second language classes, job search, those kind of things,
Yeah.
yeah.
And so they, like, when you use the example of an employment or showing up at a work site, if they show up they're not gonna work 29 days. If they show up 95% of the time, but they don't show up 5% of the time, you don't get credit and they don't get credit.
Right, it shows in our engagement level, but it doesn't show as counting in the participation rate.
Yeah, I always find that so really unfair.
Yes, it does seem unfair.
Yeah, okay,
Yeah.
thank you for explaining.
Yep, welcome. So I talked a little bit about the fact that 148 are participating, just not enough to count. The non-exempt population continues to the exempt population, continues to exceed the number of non-exempt. And in June, there were 959 who were exempt and 697 who were in the non-exempt category. Of the 697 non-exempt, 364 were in the all families category. Next is the IMA report. So that's in your handout, should be the last handout attached. It's got the yellow highlighting. And during the month of June, 123 individuals were referred to IMA for assessment. 72 individuals showed for their assessment appointment, resulting in a 41.5% no-show rate. And of the 72 individuals who were assessed, 31 did not meet criteria for treatment. 20 were already engaged in treatment and will now be monitored by IMA, and 21 will be referred to start treatment and will be monitored by IMA. And of the 41 new clients, 2 are in short-term rehabilitation, 3 are in long-term, and 36 will be receiving outpatient treatment. Most of the individuals are single individuals, 93% of those referred. And at the beginning of June, IMA was monitoring 146 cases, and at month's end, 13 individuals had completed treatment and/or monitoring, and 26 were closed for noncompliance. 12 individuals were determined to be employable, which is a rate of 7.2% for the month of June. And the average number of days to employability was 162 for the month of June.
Is that 7.2% comparable to other counties?
Geez, I haven't looked at that, but I would guess that it probably is. Because it's a lot of the single people are, really struggling with the substance use issues. Not that it doesn't happen in families, but yeah.
What's the difference in days-wise, short-term and long-term?
For short-term, geez, I don't know the definition of that. Long-term, I would imagine is longer than a 28-day rehab. Months, so we've had people be in for even longer.
Some long-term longer than other long-terms, depending on the individual?
Yes, yeah. Other questions? The temporary assistance caseload continues to trend upward. While the family assistance cases are still not at the level that they were in 2012, the safety net cases are only 3% less than they were in 2012, so they've gotten very close to the number that they were back then.
Can you predict? No, you can't.
Right.
Bad question, but your feeling on?
On why it's gone up?
No, on if it's going to continue, or you just really have no idea?
Yeah, it's really hard to tell. We really don't know. I assume it's going to continue to increase for a while,
Yeah,
but where that's gonna level off, it's hard to say.
yeah.
Is there any way to, do you track at all the participants in sense of their longevity with the county? I mean, are they people that have been here for a while in the county, or some of them, new to the county? I just was curious of the dynamics on that.
Yeah, we don't really track that. That would involve individually looking at every single case, so.
Sure, okay.
And the SNAP caseload is 7% higher than the level that it was in 2012. And currently, there are 11,201 SNAP cases. The application numbers were a little lower in June than the previous month. That really goes up and down depending on the month. But we continue to deny 36% of applications for failure to comply with program requirements. And as far as temporary housing, in the month of June, there were a total of 237 cases residing in temporary housing, and of the 237, there were 95 single males, 80 single females, 4 couples, and 54 families. 4 individuals were on parole or recently released from jail, and there were 0 individuals placed in temporary housing due to Code Blue in the month of June, thankfully. And the cost of temporary housing for the month of June was $431,151.87. So you can see on the chart on the next page that it's really trending upward. We did go down a little bit though in the month of June for the number of individuals.
The dollar amount went up, but the number of individuals went down.
Yeah, the dollar amount is really funny because that depends on when we actually get invoiced. So it really is not a good judge
So
of
it's-
whether
it
there were a
doesn't
lot of people
correlate.
or not. Yeah, it just depends on how much we can browbeat people into getting their bills in on time so that we can get them paid. Katie wasn't able to be here today for her report, but if there are questions about that, you could reach out to either Katie or I and we can get those answered for you. Are there other questions or?
Anything else?
This is an unpertinent question. Is it possible to get the numbers for, on Medicaid payments percentage-wise and also amount-wise for long-term care?
That wouldn't be me, that would be Carmen Holsta, the Director of Medicaid.
Carmen Holsta?
Yeah,
Okay.
yeah.
What's
Well,
her-
HLOSTA.
HOLSTA.
No, it's HL, O.
HLOSTA.
Right,
Okay.
yeah,
Holsta. Carmen Holsta.
yeah,
She's the head. Okay, thank
Yeah.
you.
you're welcome.
Anything else? Thank you, Diane.
All right, you're welcome, yep.
Okay, next up on the agenda is the discussion, CPS update.
Hello, Lori Dulce, Director of Certification.
Carmelo Hernandez, Commissioner of Mental Hygiene and Social Services.
So I can say things are continuing to go very well in CPS. All of our workers remain below 15. We do remain at 1 vacancy at this point. We were fully staffed for 2 minutes. And something happened with one of our new employees where the position didn't go forward. But other than that, all of our workers have tested. We're waiting for results at this point. Everyone had a very good feeling walking out of the exam, so I think we're in a very good position right now. Our delinquency rate is in below 15%, which is in the top tier for the state in terms of high performance. So our workers have been doing an excellent job.
How did they get rated? You said delinquency rate?
Yes, so the delinquency rate is, a standard CPS investigation is supposed to be completed within 60 days. There are circumstances, particularly if law enforcement is involved, if there's medical issues, things like that, where it's not unusual to go past that 60-day point, because especially with criminal charges, we can't always do what we need to do before law enforcement goes in and does their investigation, works with the DA, all those things.
Court system? And
Yes. So there is an expectation that some cases will be not adjudicated within that 60-day period. Sometimes it's just due to intake rates. Sometimes we get multiple reports on the same family. Those reports can only be joined within a specific time frame. So you may have one open here, a new report comes in and you can't join them, so now you're investigating 2 separate situations on the same family. And those are all considered acceptable reasons for us to have delinquencies. And at this point in time, our delinquency rate compared to the state average is very low.
So the delinquency means it's gone beyond 60 days?
Yes.
Okay. All right.
So are all of your caseworkers currently trained, or is there training that still needs to happen? Are they all like actually working?
We have We have 2 workers who are nearing the end of their training schedule and 3 more who are starting training. Before they start training, they've been shadowing other staff, doing task-oriented activities, doing paperwork, computer work, making phone calls, accompanying workers on home visits, doing progress notes, as much as we can do to get them trained before they're able to actually carry their own cases. So, but they're definitely staying busy. Another thing that I think is a positive, in the past month, we've had 2 workers who previously worked for either Child Protection or Services who had previously left and taken other positions, one outside the agency and one within, I believe she was in the health department, who have both returned. So we had a CPS worker who left our agency who came back and returned to her job as a CPS worker, and another worker who returned and took a casework position in Services. So I think that speaks volumes about how things are going within the division, that people who had left years ago are looking at this and deciding that this is a good choice for them professionally and coming back.
So they're still certified and they can jump right in? Or do they have to update? Or?
Yes, they do have to update. One of the workers is with Preventive Services. Their training requirements from the state are a little bit different than Child Protection, so she was able to just do an update series. The worker who's returning to Child Protection has been out of it for a while and does have to redo the training, but still is able to do quite a bit in terms of support for other workers to help them go while she's waiting for her training.
Real life knowledge.
Yes, exactly.
Anything more before we open it up?
No, like I said, I think that we're in a great spot. I think morale is improving. Our supervisors and our workers have been working very hard, and it shows in the work they're doing.
Questions?
So I was under the impression, partly based on what you had said was, and also from talking to some workers, that the way that you reduce the staff to case ratio was using supervisors and then some preventive workers, and also allowing workers to work more than 35 hours.
Several months ago, yes.
Okay.
When we had a higher delinquency rate and higher intake rate, and before we had filled all of these positions, yes, we had we had supervisors who were assisting by going in the field. We did have workers working up to 40 hours, and we did have some workers in our foster care and preventive units who were doing specific tasks. They may do a closing home visit or do some phone calls for somebody, which was strictly to bring the numbers down. With intake being the way it is, and with everyone being on an even keel at this point in time, we haven't needed to tap into those resources, and most of our workers are not going over 35 hours at this point.
Okay.
So we have that flexibility if needed.
Yeah.
We can go up to 40 if all of a sudden there's a spike in intake and something happens. We absolutely have the flexibility to do that, but right now it's not warranted.
Okay, so bringing all those cases down reached a baseline, you reached a
Yes.
baseline, and now everyone can still stay at that.
Yes.
The other question I wanted to ask was, there was some discussion about, bringing the CPS caseworkers, changing their grade allocation, and the decision was made, and I believe you had put in a request for a grade reallocation.
What we did was we looked at the entire DSS services. So we looked at not only child welfare, we looked at everyone and what that will look like from 40 hours across the board and grade reallocations, and what that would do fiscally and what that would cost overall the taxpayers. And due to the feedback and the study that we did there, it wasn't warranted at the time, and also with the Bonadillo group coming in to do their study as well, and having that third-party audit, which was finally approved and is finally good to go with the contract, we figure it's best to allow them to complete their piece of it, and compare it to also what was found internally with fiscal, ourselves, and HR when we looked at the overall division as a whole.
So you didn't look at CPS separately?
No, I looked at the whole division, at everybody.
And so you did a feasibility study based on the 62%, or whatever percentage.
Yeah, I looked at it because the thing is, not every division gets reimbursed at the same rate from the state as well. So we looked at the entire divisions from our temporary assistants, our Medicaid, our SWEs, our caseworkers, our intake, and also child welfare and also services. So we looked at the whole gamut. And what was found that child welfare had recently, correct me if I'm wrong, Lori, I believe it was 5 years ago, 6 years ago, they were reallocated already, just them. So we looked at the whole.
So, I guess what's confusing is that, say for example, even just today, there were 2 positions in mental hygiene, and a couple of months ago, there was, Dr. Fox, public health nurses. So a fairly, not all the public health nurses, but the public health nurses that work in the jail. And I guess I'm wondering, would it have been possible, and it seems like it would be based on the fact that we've had a lot of people come through smaller groups getting grade reallocations, to look at child protection workers separate from the entirety of child welfare, including Medicaid, including all the various different, different sub-departments in there.
Well, the big piece with when it comes to the mental health, they're revenue generating, so they'll generate their own revenue, so they'll cover their own salary, so that makes it a little bit easier on that perspective there. The other piece is that child welfare did receive a reallocation no more than 5 years ago themselves already, outside of everybody else and the entire Department of Social Services.
So child welfare, what do you mean?
CPS.
Okay, so CPS,
Mhm.
but then you also have preventive services. Is that included in child welfare?
No, CPS got it. If you were in CPS, go ahead.
When the reallocation happened, it was across the board. It was CPS, foster care, preventive adoption, caseworker and above. So caseworkers, senior caseworkers, and B supervisors. As it is, the way it's currently structured, our CPS workers are paid 2 pay grades above our services caseworkers and also receive on-call pay. So all of that combined, I'm not going to say that any of our workers are not worthy of more money. But I will also say that the same reasons that our CPS workers are advocating for additional money, the homes they go into, the situations they deal with, the families they deal with, they're the same families and the same situations that our services workers are dealing with. The cases from services come directly from CPS. To further split the pay range between those 2 types of positions, the services and the CPS, when as it is our services workers do not work on call, they are not able to do the on-call time and any of that. That would, I think, be, and I say this as somebody who has done both sides, I've done services and I've done CPS. I think that would be too big of a disparity between both between both units, the services and the CPS, when there's already a financial disparity between services and CPS. To further highlight that, when our services workers are doing very similar work, they're going into the community, they're going into homes, they might not be involved in most removals, but those workers may be going to court and asking for the court to permanently terminate the parent's rights on a case, a family that they've worked with for a year, 2 years. Their work is different, but it's just as difficult. And I can't say with a clear conscience that I would value either side more than the other, and to say that it would be fair to split CPS and services in that way. That's my perspective on it.
Yeah, no, and I mean, I'm just trying to, I think, but it sounds to me like what you're saying, Carmelo or Mr. Hernandez, is that you considered the entirety of child welfare that included Medicaid. I heard Medicaid.
No, I included all of DSS, and the reason I included all of social services is because we do have employees that work on the temporary assistance side and our Medicaid side that qualify for our own services. So I looked at the entirety of the department as a whole.
Okay, can you give me the breakdown of who you looked at?
Every division, the whole entire department, all of DSS. So that's temporary assistance, SNAP, HEAP, Medicaid, that's adult protection, child welfare services. I looked at the entire gamut from the DSS perspective.
So, in other words, when Lori is talking about, preventive services plus child protective services, she's actually talking about a smaller part of services than the entirety of child welfare. Is that correct?
No, that is all child welfare. What Lori's talking about is all of child welfare. What I'm talking about is all of the Department of Social Services. The first ones that we looked at was child welfare. And then I also looked at all of the Department of Social Services, just due to what we know and what they make and what they do day in and day out. Same families, just different scope of practice. So the same family that's probably being dealt with in the home, we probably see them in intake in our front office in either Dunkirk or Jamestown. So we're dealing with them in different facets.
But just to be clear, you were looking at the whole umbrella of temporary assistance.
Yes, most definitely.
Everything, not just, I believe Lori was referring to adoption, foster care, preventive services, and child protective services.
Yeah.
As opposed to the entirety of it. So is that pretty usual? Is that how the I guess I'm wondering, how did they decide to give child welfare a grade at reallocation 5 years ago?
That was before my time. I can't answer that. That wasn't me.
Okay, because I think it's fairly.
So
I'm
by,
just confused. I
right,
just wanna
no,
get
at that
situated.
point, my understanding is that compared to, comparing the contract benefits and pay rate that that our workers were receiving at that point, and I was a B supervisor at that point, so I was impacted by this as well. Comparing that to state averages and local averages of nearby counties, what the benefits package looked like for Erie County, Cat County, Allegheny County, were we competitive? And at that point, we weren't. There was a 2 pay grade reallocation done to get us in a more competitive position to hire and maintain staff. Right now, we are on par or slightly below our starting rates for the nearby counties, but when you look at the maximum rates that our workers are paid, they are at or above other counties. So there's a broader range of pay, but we are extremely competitive. Plus, there's other benefits within the contract that are direct financial benefits to our workers that are very different structure from what other counties have. I think it's also important to note that when Bonadio comes in to do their study, one of the things they are going to be looking at is our pay scales and our competitive nature and all of that to make sure that we are on par with where we should be and that our workers are getting a fair compensation for the work they're doing.
And so was that budgeted? Is that why it's already been approved without legislative voting? Is it because it was budgeted or?
Yes,
there
it was
It was
budgeted. It was included in the budget.
Okay.
Yes.
Okay. My understanding is that Cat County certainly starts at $2 more an hour.
Approximately, yes.
Okay, but you're saying, I mean, I guess I would ask if we could have some kind of comparison of, some kind of understanding of how you view changing the grade like something that says 5 years ago. Can you give us the actual, in writing, the actual thing that says 5 years ago, this was the grade reallocation?
I wasn't in this role, and Carmelo was not acting as commissioner at that point in time. That was handled by Christine Schuyler and Leanna.
It seems like you're nitpicking here.
Well,
I mean to be disrespectful, but I'm totally confused on
I
where we
guess
started.
what I'm
where we're
trying,
at.
okay, I mean, okay. I just wanna make this point, cause I'm not trying to nitpick here. I mean, this has gone on for months, and I would say that part of the problem is that we really are not, it's great what you're saying, it's wonderful what you're saying, and I really appreciate that. And, when I say what I've asked for in the past, in writing, had meetings, been whatever, the last time I met with, Mr. Hernandez, we had a discussion of certain things that would be sent to us in writing, which we never really got. And I guess when you say I'm nitpicking, Mr. Landy, the thing that is, I think, a legitimate question is, could we have this information, the answers? I mean, I sent easily 20 questions that have never been answered based on the fact that there were CPS workers who were coming to our meetings, and I know now we say they are not coming anymore, but to me, I think the We need something in writing that actually verifies, that answers those questions, and I think that's a legitimate request.
But I don't, is it the role of the legislature to determine pay and benefits? I was
No,
under the
I
impression
don't.
it's not.
So, no, I
But
appreciate what you're saying.
We're questioning the why,
Okay.
the,
No, and I think I kind of, I see both sides. But, at this point, why they determined what they did 5 years ago really is kind of a moot point at this point, so I agree with Mr. Landy. And I think that moving forward, you have a good approach that you want to see what this study is going to do. We're paying it's around $300,000 for this study, right? Or
I believe it's
$180,000.
$180,000,
Okay.
which is a comprehensive study. It's a time study, it's a policy, it's a compliance, it's staffing, it's everything.
and pay.
That's
And-
a,
yes.
yeah, and my point, that's a large investment to really see exactly where we're at. And that is an outside auditing agency that's gonna answer your questions, Susan, and I really support that we're anticipating what that study will portray. And, you've done your internal study, which finds that you are really competitive, and, you're happy with where you're at. It kind of shows because we have had some retention, we've had some people come back, so that is a proof of it in itself. And also, we haven't had the people come into the meetings, so there's been some things that have been corrected, which is great. And I think that waiting for that study is gonna be important, because it makes those questions that you're asking more relevant, because that study is gonna answer them, very soon. When did you
So-
expect that study to?
Yeah, actually started in January, so everything got approved, contract went out, we just signed everything, so they'll be ready to go here starting in January. And it's a comprehensive longitudinal study, takes approximately 9 months, but they go by sections, and every time they complete a section, they give a report, and then they give a final comprehensive report on all their findings. Good news is that, this is the only group that does this for, Office of Child and Family Services. Nobody else does this. They do it across New York State. They are approved when it comes to this line of study and this line of work. Typically, when they get called in is when a fatality happens, and there's things that have been happening that are pretty shady. So them coming in on this end, I think it's just gonna make us better. To be quite honest, I think it's just going to make us better. I do know, and I could get you those numbers, when myself and John Anderson sat down and we looked at the pay scales. On the low end, starting end, we were low by like $2, but on the high end, we were competitive with Erie County and New York City, which are completely bigger than us.
So I just want to make 2 points. And I think that's what committees are for, discussions. Even if the discussions go on longer than some people want them to go on. This is my point.
We're not the only one.
It doesn't matter. This is a
That's fine.
discussion, and this is a committee meeting.
I understand. I meant no disrespect.
Okay. So in any case, I think the thing is, there were a number of, when you say those questions will be answered, that's fine, but there was never anything that was sent that said, oh, thank you, these are questions that will be answered. That has never happened. We have not, I sent them to multiple people, and they were never answered. And that is why I feel like, or why I think we need to have those things in writing. And that is why I don't completely, feel comfortable with the process. Because in July, I was brought into a meeting where I was grilled and asked what the issues were. And then we had a full discussion, and never have those questions been answered.
I disagree. I respectfully disagree. I think Lori did a great job of answering the questions. Of them being in writing, that will have to come from legal. We would send it to legal, and legal would send it forward. And that's okay. In terms of 5 years ago, none of us here could answer that.
There's no record of what your raise was 5 years ago. No,
I'm
the
sure
great
that's a human
reallocation.
resources.
Okay, and that's an
Question.
easy thing to pass off, but the
Yeah.
other thing, and I mean no disrespect, but I think the other thing is that when, say, for public health comes in here and says, we want to do this, or this is the answer to your question, we get the answer in writing. Every month, Diane gives us a full report. Dr. Falk gave us all the legitimate reasons why they needed to have certain raises. And I think it's a reasonable request to ask for things in writing. And I don't think it's acceptable to say, 5 years ago we weren't here. If you should know, or not you should know, that's not respectful. But I think the
Can
thing
answer it.
is, no, I think the thing is that it's easy to find out what happened 5 years ago. You might not think it's legitimate, but there has been a whole series of events that have come forward. And Lori has answered a lot of those questions, but a lot of those questions have not been answered. And I have concerns about that because I feel like, I think that this is not a completely honest and transparent process from the beginning of the questions when your CPS workers came to discuss things. They had questions, and they brought those questions to us. And we bear some responsibility to ask those and get answers in writing, I believe.
I mean, I heard a lot of their questions were based on caseloads and help and all that.
Yep.
And I think that's been answered, and
think so.
corrected.
Well, I respectfully disagree based on the fact that I've asked, I agree that Lori has brought a lot of stuff. You have answered a lot of questions, but the entirety of this issue has not been solved as far as I can see. And, you know, it's okay for me to disagree, and it's
Yeah,
okay for you to
absolutely.
disagree with me.
It is all on the record though, right? These meetings are all,
Should be.
Can you say that again, Jamie? I didn't hear.
it's not in writing, but these meetings are all recorded. So there is a record of
Oh,
it, even
okay.
though it's not in
Yes.
writing,
Absolutely.
even 5 years ago.
Right. I don't know if they were filmed 5 years ago.
No, they weren't.
So there probably was a record.
They were not filmed
They were
5
not.
years ago.
No, but was there written notes because there wasn't?
They were transcribed verbatim.
They were transcribed, okay. Okay, well, thank you. I appreciate you listening to me, and I'm sorry to be so hard on everyone, but it really is something that I had to say.
That's
So,
an
thank
important
you.
issue. It's a very important issue, and an open discussion is good to have.
And I would like to say that I think having the Bonadio Group come in as an unbiased resource to come in and take an honest and frank look at not just our county, but the neighboring counties and what this looks like, I think is probably going to be the fairest assessment for everybody involved. And many other counties within the state have used this service, have gone down this road to make sure that their staff are fairly compensated, that the workloads are being managed appropriately, all the things. And we have every intention of taking their recommendations and their reports very seriously. This is a huge investment that I don't think any of us have taken lightly.
And their reports will be,
Oh, yeah.
Unbiased and
well,
non-emotional.
I mean.
Yes,
Open to, and transparent, open to all of us.
yes.
And they are certified or
Yeah.
authorized by the state.
Yes, they
Yes.
authorized
The
by
only
the
one.
state. Yeah, the only one that that actually knows child welfare, because it's very complex in terms of all the grants that come in terms of all the programming. So they come highly recommended. They're just finishing up Jefferson County as we speak right now. So and they had to. Jefferson County had to hire them due to certain things that happened over there.
And
Do
we
go
have
through
done
other
work.
audits, federal audits?
Yes, we do.
Any
Yes.
other state audits?
Yes.
Yes.
And how have those?
Last one went great. You
Yeah.
can speak about it.
We actually just had a federal audit. Well, the audit was, I should probably explain this a little more clearly. It was an audit of New York State by the federal government for compliance with state and federal policies. Chautauqua County was highly recommended by our regional office to be one of the representative counties. There were 2 counties and New York City chosen. Chautauqua County, I believe Jefferson,
was the other one,
and
New York
then
City.
New York City ACS, which is standard. ACS is always part of these. And the reviews that were conducted were done over a full week. There was a full review team, about 25 people who came in who had different roles. They looked at compliance, they looked at specific cases, they did face-to-face interviews with staff, family, services providers. It was a hectic week. And by the end of that week, the reviews that we had from the state and from the federal auditors were, and I can't stress this enough, were incredibly positive.
When was this?
This was
About
just
2.5 weeks ago?
mid-September. The words, some of the best work we've seen in the country were said several times about different aspects of what we do. And the review was primarily regarding services cases. But since a vast majority of our services cases come from CPS referrals, by nature, CPS was reviewed as well. Workers were brought in. And our people, some of them were called like, hey, the reviewers want to talk to you today. Can you make yourself available? And they did, with no prep, no time to review their notes, no time to sit down and go over what they were going to be asked. They showed up or answered a phone and did a phenomenal job. They know what they're doing. They know their cases. They're strong workers. And in that audit, we did exceptionally well. I mean, the feedback we were given was amazing. And I'm not overstating that. It was really impressive to hear the results at the end of that.
One of the federal auditors, because they were a combination, none of them were from this county, literally pulled myself and John Anderson at the last day and pulled us to the side and said, this is the best work I've seen across the country in 25 years. This is one of the best I've seen.
Was this mostly, when you say services, you mean preventive, like you're talking majority preventive services? Under Melissa
McMahon. So because it was, a lot of the audit was regarding financials, and services is the much more expensive piece of this. So yes, the focus was primarily on the ongoing services, preventive, foster care, and adoption. But by nature, those cases came from child protection, so those records were also pulled. Those policies, procedures, and worker actions were also reviewed as part of it, because it gave a comprehensive start to finish review of the case. And all of that combined, they broke it down into many different specific areas that they were looking at, but really all of their feedback was very strong. There were a couple areas where they recommended improvement, but by recommended improvement, we were at 85% of the goal out of 100, which meant maybe one or two cases didn't meet their standard. Which for an audit of that style, going into that in-depth with all of our cases is a very, very positive sign. So we're doing something right from start to finish with our cases. And this was a chance for the federal government to come in and say, New York State as a whole, you're not doing this correctly, and here's what the corrective action is going to be, not just for Chautauqua County, but for New York State as a whole. There's potential fiscal penalties, all of this, and we were recommended by our regional office to be the representative for New York State practice. It was quite the undertaking. Melissa put a lot of work into getting this all ready, getting all the cases, getting everything scheduled and organized. And it was quite the undertaking, but in the end, we showed that our county does exceptional work in this area.
Yeah, thank you for that. I think that's wonderful. Melissa was mentioning that the other day when I was at
Yes.
that public hearing. And it sounded really wonderful. And also, I just wanted to say thank you for making that effort with the hiring, and it sounds like the ratio has gone down, and I'm glad to hear that it's steady.
Yes.
I mean, I think you're definitely doing a lot of good things.
Thank you.
I'm not saying the other part is not true, but yes.
We can always improve. And you know what? I feel we're mid-October now. We've already kind of had our back to school rush, and our workers are managing just fine. They're working together. There's their support for each other is really getting them through this, and it's really great to see.
Good, thank you.
Thank you.
You're welcome.
Congratulations on your audit.
Appreciate it.
Thank you.
Thank you.
Is there any other business at this point?
No.
Make a motion to adjourn.
I second that.
Second, all in favor?
Aye.
Richard, thank you.